Hi, my name is Cyrus Yazdi. I'm a pain physician, and welcome to my YouTube channel, Ask Your Pain Doc. Today, we're going to talk about low back pain. Low back pain is the number 2 reason that Americans see their healthcare provider. It is second only to cold and flu. Nearly 65 million Americans reports a recent episode of low back pain. 70% of people experience low back pain throughout the lifetime. When we talk about low back pain, we usually divide this in 2 categories: the acute low back pain and the chronic low back pain. Acute low back pain, which is back pain for a few days or a few weeks, and most of the times gets better on its own. The chronic back pain, we usually refer to a back pain that lasts more than 12 weeks. Things that can cause low back pains are our daily activities: lifting heavy objects, trying to turn or twist, shovel in a really heavy snowy day, sudden movement, or if you slip on ice, or if you fell. One of the other common things that can happen and can trigger severe back pain is poor posture. Where these days we're doing Zoom meetings all day and we're leaning forward towards the computer and looking at the monitor all day. Sport injuries, especially the sports that have very high impact like football, basketball, soccer, or anything that can cause severe force into your lower back. So what are the causes of low back pain? The most common ones are injury or damage to muscle or ligaments, or a simple word, severe muscle spasm. The rare causes could be because of disc herniation, fracture due to osteoporosis or weak bone, and or cancer or other very, very rare disease. But don't worry, it's usually because of the severe muscle spasm or slight ligamentous injury that you'll have severe low back pain. And most of the time, it will go away by itself. In terms of treatments for low back pain, most of the time, this will get better on its own. So you just have to rest as much as possible. Activity modification: stop driving, stop doing heavy exercise, and rest as much as you can. Heat and ice. If there are a lot of muscle spasm in your lower back area, heat may help you as it will relax the muscle. And if there are a lot of inflammation in the lower back area, cold may help you as cold reduces down the inflammation. You can use a lot of over-the-counter pain medication, including Tylenol, aspirin, ibuprofen or Advil, and naproxen or Aleve. And also you can use lidocaine patch over your low back area. If you're using medication from class of Advil or naproxen, those medications may irritate your stomach. If you had history of gastric ulcer or gastric bleeding, you have to be careful with this medication. It's also very important to take these medications after a snack or after a meal so it won't hurt your stomach. If your pain does not get better, if you have severe radiating pain and you're having weakness and severe numbness in your legs, and if you have any change in your bowel or your bladder habits, it is time to see your doctor. And thank you so much for watching this video. I hope you enjoyed it. In our next video, we're going to talk about disc herniation and sciatica, or the radiating pain down to your legs. I would like to know your feedback. If there is any topic that you would like me to talk about, please write it down and I would be happy to make a video for you. Please support my YouTube channel by following me. Stay tuned and I will see you guys soon.